Senator Burr.
Dr. Martin, in your testimony, you note that Canadian doctors exiting the public system for the private sector has had the effect of increasing waiting lists for patients seeking public health care. Why are doctors exiting the public system in Canada?
Thank you for your question, Senator. If I didn't express myself in a way that make myself understood, I apologize. There are no doctors exiting the public system in Canada, and in fact, we see a net influx of physicians from the United States into the Canadian system over the last number of years. What I did say was that the solution to the wait time challenge that we have in Canada, which we do have a difficult time with waits for elective medical procedures, does not lie in moving away from our single-payer system towards a multi-payer system. And that's borne out by the experience of Australia. So Australia used to have a single-tier system, and in the 1990s moved to a multiple payer system where private insurance was permitted. And a very well-known study by Duckett et al. Was tracked what took place in terms of wait times in Australia as the multi-payer system was put in place. And what they found was in those areas of Australia where private insurance was being taken up and utilized, waits in the public system became longer.
What do you say to an elected official who goes to Florida and not the Canadian system to have a heart valve replaced?
It's actually interesting because, in fact, the people who are the pioneers of that particular surgery, which Premier Williams had, and had the best health outcomes in the world for that surgery, are in Toronto at the Peter Munk Cardiac Centre, just down the street from where I work. So what I say is that sometimes people have a perception. And I believe that actually this is fueled in part by media discourse, that going to where you pay more for something, that necessarily makes it better, but it's not actually borne out by the evidence on outcomes from that cardiac surgery or any other.
One would believe the American people prefer their system because they know consciously they pay more. No, I think it's because they judge quality and they judge innovation. Ms. Pipes, in your testimony, you noted that more than 42,000 Canadians come to the United States each year for health care. Why is that?
Because they find that they're on a waiting list in Canada for too long a period and they feel that their health is at stake. So a lot of people in Canada come to the U.S. for MRIs, CT scans. There are many examples in the media of people like Brian McCreath who came to the U.S. because he was told by his primary care doctor that he might have a brain tumor, but the wait for an MRI was very long. He spent the $1,000, came to the U.S., paid out of pocket. You will see advertisements in Canadian newspapers for MRIs, for neurosurgery.
It's a pretty fertile ground to market in.
Right.
Dr. Martin, in your testimony, you state that the focus should be on reducing waiting times in a way that's equitable for all. What length of time do you consider to be equitable when waiting for care?
Well, in fact, the Wait Time Alliance in Canada, sir, has established benchmarks across a variety of different diagnoses for what's a reasonable period to wait. And what we've found is that actually working within the single payer system, we can reorganize things. You know, I waited more than 30 minutes at the security line to get into this building today. And when I arrived in the lobby, I noticed across the hall that there was a second entry point with no lineup whatsoever. Sometimes it's not actually about the amount of resources that you have, but rather about how you organize people in order to use your queues most effectively. And that's what we're working to do, because we believe that when you try to address wait times, you should do it in a way that benefits everyone, not just people who can afford to pay.
On average, how many Canadian patients on a waiting list die each year? Do you know?
I don't, sir, but I know that there are 45,000 in America who die waiting because they don't have insurance at all.
I live 1 hour away from the Canadian border. Canadians watch American television. Canadians are very familiar with our political system, probably know more about politics in America than most Americans know. Is your Prime Minister a socialist?
No, sir, our Prime Minister is quite conservative. He's the leader.
Conservative?
Yes, indeed.
So obviously, as a conservative, he wants to implement the American healthcare system that the Canadians are very aware of. I gather that was probably the first thing he did when he took power. Is that right?
Not exactly.
Why not?
Support for single-payer Medicare in Canada goes across all political stripes. Quite famously, we had the leader of the most right-wing party in a Canadian federal debate on television hold up a sign in the middle of the debate on which he'd written in marker, "No two-tier," as a means of trying to reassure the Canadian public that if elected, he would not dismantle the
So in other
single-payer
words,
system.
you have a nation bordering on the United States, two nations that are probably as close together in so many respects as any two nations in the world, a conservative prime minister, and yet there is no effort to move to an American healthcare system. I would say to my colleagues, there's not a better example of maybe how people feel about two systems. They know the American system. They have a conservative prime minister. They can move in our direction, but for whatever reason, and I think sensible reasons, they understand that a system that guarantees health care to all of their people in a cost-effective way is the way that they want to stay. Ms. Pipes, let me ask you that question. Why do the Canadians not come to the American healthcare system?
Well, as I mentioned in my testimony, about 42,000 Canadians every year come to the U.S. and pay out of pocket for assistance.
That wasn't my question.
No, I just made that. I wanted to make that point first. Second, the Canadian government and the provinces who administer the Canadian healthcare system. This started in 1974. A lot of people in Canada have no idea of an alternative system.
Oh, my goodness. They live an hour away from me in Burlington, Vermont. They watch American television. They read American newspapers. They have no idea of what goes on in the United States of America. That is a little bit hard
and
for me to
also,
believe.
I would say that Canadian people are very, very nice people. They're not impatient like Americans. My mother said to me, I hope you're not becoming an impatient American. I am an impatient American. Americans do not want to wait. Canadians are very nice.
Well,
the doctor
I think,
says, and then the second...
Ms. Pipes, I have a limited time.
Yes.
I think the answer is pretty clear. The Canadians have seen the American system. They prefer their own.